Hello, and welcome to Tech Talk Community Conversations, the quarterly broadcast from Dr. Jill Bowen, Commissioner of the City of Philadelphia Department of Behavioral Health and Intellectual Disability Services, in which we explore the work DBHIDS and our partners do together to address the key components of TEC, which stands for trauma, equity, and community. So now let's learn about TEC. Dr. Bowen?
Thank you, Mark, and hello and welcome to Tech Talk Community Conversations, the video series in which we explore how the work we do at DBHIDS and with our community providers and partners aligns to address trauma, achieve equity, and engage community. Today, I am thrilled to be joined by Cherie Brummans. Cherie is the CEO and Executive Director of the Alliance of Community Service Providers here in Philadelphia. She has been helping to serve the people of Philadelphia for 15 years, including almost a decade in her current position. Cherie, why don't you tell us a little about your work and how it aligns with the priorities of trauma, equity, and community?
Absolutely. Well, hello, Dr. Bowen. Thank you so much for having me today. It's really an honor to be a part of this podcast. I think this is TEC is a really important topic, and really encompasses most of the work that we do at the Alliance. So generally speaking, the Alliance of Community Service Providers serves three different areas: mental health, drug and alcohol rehabilitation, and intellectual disabilities and autism. And most of the people that we represent are funded through either DBHIDS or through CBH or both. And generally speaking, we do three main things, and these are not in any level of importance, but they all sort of touch on trauma, equity, and community as well. Our job is to represent the providers, the people that work for those providers, and inadvertently, but by proxy, the people that they serve as well. So we do three main areas or three main types of work. So the first one would be networking and people connection. And so that's a really big part of the work we do to try and connect people, our providers, to the things that they need, the services they need, the education that they need, bringing people together for a shared purpose. And we do a number of, events and that kind of thing. We have a great event every year at the Bellevue that, brings other experts from outside of the city to help us grapple with the issues that we're dealing with in Philadelphia. Second one is workforce development. And what I will say about workforce development, and I'm probably going to focus the most on today because I think it's really important, is that this is paramount to the work that all of our providers are doing, that all of us are doing in the city of Philadelphia. I always refer to it as the work we can't not do. So it's important to me for a number of reasons, but the real most important one is an equity issue. I'll go a little bit more into that in a minute. Let me just share the other piece of the work that we do that's around lobbying and advocacy. And so a lot of the focus that we do in the lobbying and advocacy place is at the city and the state level, and to some extent a federal level. So I'm going to go back to workforce for a moment because I said it's the work we can't not do. Our providers don't have businesses. We don't have organizations without our workforce. That's clear. And we really don't have organizations that function without direct support professionals. They are the glue that keeps our providers together, right? They are the ones doing the work on the ground, right?
Great.
It's also true that that particular group of individual workers is mostly comprised of people of color, largely women, people with a lived experience of mental health or intellectual disabilities, and the LGBTQ and trans community, and on and on and on, right? So that's a very diverse community of people. And so when I talk about equity, it's not lost on me that it's also an underpaid group of people. And so we are serving, if you think about the people that our members serve, when I say members, I mean the organizations that belong to the Alliance. But if you think about the clients that we're serving with mental health, drug and alcohol, or ID and autism, they are also often struggling with low wages, poverty, and that kind of thing. But it's interesting because so is our workforce. And so it's no secret to anybody who works in this field that we have an underpaid workforce. But I think if you ask the general public what they think about healthcare workers, they would assume that we're all, doing pretty well, paid pretty well. And it's for a number of reasons that direct support professionals haven't really been put into a category where other workforces have, where wages are seen as something that need, to be dealt with at the state and federal level. We're working really hard to change that. And so we do sort of two, types of work at the same time. We do advocacy and lobbying, and for that we're advocating for increased wages, because talk about a case for inequity and inequality, right? And then also sort of trying to get our mayoral, so we have a new mayoral election coming up, a general election, and we're trying to get our city and state officials to understand that the connection to trauma, equity, and community, and the reasons for, if we're going to address things like gun violence, which is a big hot issue right now in the city of Philadelphia, they are inextricably connected to trauma and inequity and community issues and poverty. And so we work really hard to try and get those connections to be made. In terms of the workforce, though, I'll just circle back to that for a second. So our workforce also has a whole lot of social determinants of health that are not being met, right? So if you're working 2 or 3 jobs just to make ends meet, so you can pay your bills, so you can eat, so you can have transportation, healthcare, childcare, all of the things that make it possible for us to go to work and have a life that's fulfilling, a lot of our workforce are really struggling with. So at the Alliance, one of the ways that we feel really strongly about dealing with and addressing some of those inequities is to support our workforce.
So let me just step in here. So let's focus on the workforce, because for sure the way in which you're tying it in really does reflect equity. But so our workforce is also part of the community, right? Right. So folks live here, they raise their kids here, they go to religious services here. It is their community. And the challenges of our members, of the people we serve, are also reflected in our workforce. And so it's hard to, I think, speak about one without also speaking about the other, right? That's where that inextricable link also happens. And I really appreciate your focus on DSPs. I know that we both are very committed to that population of folks who serve so deeply and in such a committed and dedicated way, and make a difference in people's lives in innumerable ways. So when we talk about workforce wellness, we know right now that they are facing all of the traumas that the rest of the city is facing, and it's having an impact, right? So that's definitely the gun violence, people's sense of feeling safe. For sure, it is substance crises that have reached, really challenging levels. Also, though, the pandemic, which we are on this side of the pandemic, but from the workforce perspective, we are very much in a situation of kind of a workforce crisis, where we have significant vacancies in the social service sector. And it is having an impact in our ability to serve. So supporting the workforce equals supporting the members, and supporting the members equals supporting the workforce, because we are one community in many, many different ways. So I really appreciate you elevating that here as very directly tied with TEC, the trauma, as well as the equity and the community. So all of the things that we put into place to try to address that are significant, but I'm really interested to hear some more about some of the ideas that the Alliance has had, and how the Alliance has tried to address some of these challenges.
Sure, absolutely. Well, and you mentioned that the pandemic, right? And we are sort of on the other side, but I know for people like us who work in healthcare, it's still top of mind for us, right? It hasn't just gone away. And what I see a lot within our workforce, and the things that I'm hearing and seeing, is that, yeah, we have an extreme vacancy issue. We also have a vicarious trauma that is existent, right? It's baseline. And not only, I mean, this was in occurrence before. This was at play before the pandemic, and now it's pretty significant. So, you know, listen, none of what we do solves the problem, but we try to do, you know, my motto within the Alliance and to my team is we're going to take the next right step, right? We're going to do the next right thing. And that's the best we can do today. And so one of the things we're doing, and you know this, we have a big conference coming up next week, specifically for direct support professionals. Now, you know, does a one-day conference fix it? No, of course not. But it does bring our DSPs together in a room, creating that word community, right? Community is there, giving people an opportunity to practice wellness. Our whole afternoon workshop sessions are only about wellness. And then gives people an opportunity to get education, celebrate them. That's a big one right there, that celebration of them. And so that's just one, I get it, tiny little thing that we're doing, but I think it's an important one. And this year is our 20th year, so that's exciting.
Fantastic. Yeah, I wouldn't, I wouldn't minimize the importance of that acknowledgement, the highlighting the importance and the value of folks. That's so critically important. And then giving them tools and resources that can be helpful. The daily work is hard. The daily work is hard across the board for, in the behavioral health, workspace and in the intellectual disability workspace. It is, this is not easy work. This is hard work. And, what I have noticed, I'm curious your thoughts on this, is that when people, think about careers that they want to go into, there's a lot of passion behind choosing the social service sectors, choosing behavioral health, and, especially the sort of public behavioral health, but behavioral health in general, is a lot of passion behind it. And during the pandemic, folks who were, moving in a particular trajectory were faced with some things that they hadn't been faced or hadn't looked at before, because they were really driven and committed to the passion. Things like personal safety, things like alternative options and compensations and things like that. So we still have a really committed, dedicated, passion, and really mission-driven workforce. But some folks stepped off who probably wouldn't have because of all of the challenges that, were particular to, this kind of work, or the work, the kind of work that we do. I think telehealth is really helpful and has made a difference. But there's still a lot of, just in person and in the field and direct care work that is, critically important in our field.
Yeah, agreed. Yeah, I know. I think at any time, any moment in time, we're all, juggling a bunch of different balls. And if you look on the ground, there's always one or two on the ground. We can't possibly have them all up in the air. And I think one of the things that happened with human services workers over the pandemic is that just became too many of those balls to juggle, right? And they couldn't. And so when faced with, we all have our list of good and bad about anything in our minds. And when the list for the bad becomes a little bit more than the list for the good, that's where people start making those decisions. But we are doing some things, like we partner with some major universities, Jefferson, Widener, the community college, offering discounted programs for our DSPs and others who want to get an associate's degree through a bachelor's degree and then on through a master's degree. And that idea during those education experiences is also to try and make connections with our DSPs and people who think they might be interested in human services, to talk to people who are doing the work, so that they don't come out of college and go, get plopped into a community mental health center and go, nobody told me what this was, So I think that's important too, to have those experiences.
Right. So what you're doing there is really great, I think, Cherie. I mean, what you're doing there is both career development and creating opportunities, as well as pipeline development.
Right.
You're actually doing both at the same time, and it's really enriching for those earlier in their careers or considering their careers, and those who are looking for career development and growth, and you're supporting both of those at the same time. So I think that's a really wonderful way of going about it. I do think that the pipeline is really important, because we're still at sort of the tip of the iceberg here on the repercussions of the pandemic, but also all of the significant contributors to trauma in our communities. And so we need to be prepared for this. These are the public health challenges of our times, and they're significant. And so preparing means looking upstream as well as addressing the immediate, and looking very much towards the future and what the future of behavioral health care will be, and how to meet the needs of a increasingly distressed population.
Yeah, for sure. And it's the long haul work too. So it's not the satisfying kind of work where you get to do, it's not a one and done and you get to say, hey, look what we did. Pipeline work is long haul work, but you do have to trust in emergence and trust what's going to come out of it. And I think I want to be doing that, so that in 10 years from now, we're not looking back and going, why didn't we do something about it?
Right. I mean, one of the real treasures of the Alliance is that sense of actually an internal community right there, is that it's providers coming together to have shared voice, to have shared training, to have shared opportunity to discuss challenges and to come up with solutions. So I think, coalitions and alliances like that are needed now, I think, more than ever, to really come together in that really, really critical way. And like anything, each voice is important. Collective voice has greater impact. So really appreciate all that you do in your role. Really great partner for the city and for the people that we serve. So unfortunately, we are rolling out of time here. It would be great. I always really enjoy spending time with you. I know we have a lot that we think of, like-minded, and working to make those changes that are needed for the people that we serve and the people who provide the service. So thank you so much, Cherie. And let me just say, thank you for your time today, the work that you do, and thanks to all of you for watching the DBHIDS Commissioner's Tech Talk Community Conversations. We will have another Community Conversations talk in January, where we'll again have a guest who can help us learn more about the important work that we do along with our partners here at DBHIDS to address trauma, achieve equity, and engage community. And thank you. And Cherie Brummans, you are a tech champion.
Thank you so much.